So we're going to just dive in and get started. So welcome to Hope Around the Globe. This is a sort of a joint webinar because Tufts University is celebrating Tufts around the globe. And it's the annual Global Month for Tufts University, where we highlight all of the things that we do around the world. And in addition to that, it's also kind of our kickoff to our third annual summit for Hope, Healthy Outcomes from Positive Experiences. So I'm really, really excited because I think, going to learn a lot from our guests tonight. And this is intended to be a conversation. So if you have questions, you can pop them in to the chat, and we will try to get to those, but we're going to go ahead and get started with some introductions. So, of course, I'm Allison Stevens, and I am the Director of Networks and Policy for the Hope National Resource Center. So I really focus on doing external outreach with parents and families, also with organizations that are implementing Hope, and in developing new programs, such as our new certification program that will be coming out this summer. So I guess we'll get started in order on the screen. Rebecca Grace, would you like to introduce yourself?
Sure. Hi, Alison. Hi, everybody. So I'm Rebecca Grace. I'm a professor at Western Sydney University in Sydney, Australia. And I'm the director of a research centre there, which is called TEACH, where TEACH is an acronym that stands for Transforming Early Education and Child Health. So we're a cross-disciplinary applied research team focused on children and families.
Great. We'll just keep going. Dr.
Am I next, Lynn? I'm Lynn Kemp. I'm a Distinguished Professor of Nursing at Western Sydney University. My professional background is as a child and family health nurse, and I'm director of a research group called TRESI, which is an acronym. We love our acronyms, for Translational Research and Social Innovation. So I predominantly do work with children, young people, and families experiencing adversity, and community-based programs to support development and implementation of community-based programs to support them.
Awesome. So Kuhn?
Hi, everyone. My name is Teniola Okun, and I am a community health specialist at a public health authority in British Columbia, Canada. And my role is focused on positive and adverse childhood experiences, which involves me working collaboratively with community partners to develop resilience to prevent and buffer ACEs, and on upstream work that touches on shifting social norms, influencing healthy public policy, advancing upstream programs, and using data and evidence to inform community action. Thank you.
Great, thank you. And Saya Westerland Cook.
Hi, I'm Saya Westerland Cook, and I live in Finland. I'm working for an NGO called Folkhälsan, which is the biggest Swedish-speaking social and healthcare NGO in Finland. And I work for a department called Families and Relationships in a team that does targeted support for families or individuals who are vulnerable. And I'm also doing a PhD on positive and adverse childhood experiences and how that may or may not impact or be a risk factor for parental burnout, and how hope could mitigate it. Yeah, that's about it.
Great. Thank you so much. Again, so excited that all of you were able to join, because I know there are a lot of different time zones involved. So thank you very much. And so next, I just want to give a really quick overview on the next slide, just to kind of ground everyone with what we're doing. I did mention that this is one of the events for Tufts overall, in addition to being an event for the Hope National Resource Center. And so the theme this year is confronting global challenges to human well-being. And we really think that the Hope framework can support that theme effectively by promoting connection and dialogue. So the things that we really want to highlight as far as how hope can apply in a global setting is that hope can work in any child and family service setting. It can work at individual, family, organization, and systems levels. And it's designed to be adaptable to the specific culture of the implementation setting. And so just want to kind of reiterate that one of the reasons that we maintain hope as a framework is because it can be adapted and it can be flexible, and it's not a rigid model that has to be followed to a specific fidelity. It is all about incorporating the culture of the community and the individuals that you are supporting or serving. And so with that, we'll just get into some questions, and I'm going to, I want to make sure everybody has an opportunity to respond. So I guess we can just start. The first question is, what made you decide to try the Hope framework? This is an easy one, hopefully. So we'll start with Lynn Kip.
So I was introduced to the emerging evidence on the importance of PCEs at a conference in 2019 in Washington, DC. And then I attended the first Hope Network Summit. So this is the third, so that's a couple of years ago now. And I finally felt like, here's my tribe. We'd been working from the perspective of salutogenesis, strengths-based approaches, working in partnership with families, concepts of social capital in terms of the importance of connection and positive approaches to child development for many years in our early childhood programs. But the Hope framework sort of finally gave me a clear and easily understood language to promote the importance and the effectiveness of positive experiences in our children's and families' lives. So that's where we came from.
Great. That's kind of similar to how I came to Hope as well. I think we all have a Hope story. Would anyone else like to jump in?
I can go. For me, Hope is new, and I just came across Hope like through research, because like my role is new and it's kind of like one of its kind here in Canada. So as the role is evolving, we're trying to so part of my work involves building capacity, working with community organizations to kind of raise that awareness about ACEs. But we wanted to also kind of talk about PCs and how that's important. So doing the research of finding like information out there that talks about PCs, I came across Hope framework and I found it very interesting and intriguing. So I decided to kind of try to incorporate that into like my like the way I build capacity with community organization, because I appreciated how the 4 building blocks kind of helped to describe the importance of PCs. It helped me to pass across that message in a way that my community partners can understand, think about it, and see how they can incorporate that into their programming when they're working with families and children, and how that it's important in healthy child development and promoting resiliency.
Great, thank you. And next.
I could join because I recognize much of what's already been said. I think for me, both through my work and my research, I felt like there was something missing. We've been implementing systemic practice in Finland for the past 4 or 5 years. And in child protection, it's often about risk management, and of course, then you're mapping out the risks. But if you make decisions based on solely sort of the ACEs that are being accrued without seeing all the positive and the protective experiences or relationships in the child's life, you might miss something really, really important. And I felt the same for my research, that we're doing a lot of work in Finland to raise awareness about ACEs, but it doesn't really feel ethical necessary to just focus on that. We need something else to balance it out and have a holistic view.
Yeah, I would really agree with you. I think it's an excellent point. And so many of us have been in that situation where the focus is solely on ACEs. And I think while all of us understand that traumatic or adverse experiences do have an impact, it's also really important to realize that that's not the whole of who people are, and that doesn't determine who they will become. So that's a really excellent point, and we're glad that you were able to find hope. And finally, Rebecca Grace.
My comments reflect very much those that have already been expressed by the other panel members. So obviously Lynn Kemp and I work closely together. We're at the same university, and we're part of the same teams, and it was Lynn that introduced Hope back to our team based on her exposure through the mechanisms that she's already described. But I think what was really exciting to me is, like most researchers over the last 30 years, both researchers and practitioners, we've all been very conscious of the importance of a strengths-based approach. There's a lot of talk about a strengths-based approach, a lot of people expressing commitment or subscribing to this position. There's a rhetoric, there's a wording around it, there's a lot of talk around it. I do think there are quite deliberate attempts, and there have been for many years, for researchers and professionals to try to identify the strengths and to see them. But for all of that talking and for all of that identification and for all of that commitment, it's had very little impact in terms of practice and the way that we work with children and families, particularly those who experience significant adversity. We still shift. So while we might say all the right things in our practice, we shift right back to a focus on intervention and identifying the things that need to be fixed. So what I found really exciting about this approach was that it provided a way to operationalize a strengths-based approach, to give it a foundation and a focus and a way of moving forward, past commitment to the general principles to, a sort of concrete way of being able to implement those principles in practice. So that's what I find just so incredibly exciting about this approach. And I think that's why it has the potential for such significant impact.
That's great. And I think we all kind of have that experience as well. I know for me, I have heard strengths-based over and over and over again. And I hear from many, many organizations that we do trainings with who come to us for resources with Hope, that this is a way to kind of say, how do you do it? And how do you do it on a daily basis? And how do you maintain that? Because for the vast majority of us, we've been trained year after year after year, formally and then informally with just the norms of the profession that we're in, to really focus in on risk assessment or to identify, as you said, what needs to be fixed. And so I agree. I think that's one of the things that's great about Hope. And I think that's resonating with a lot of folks that we work with. So with that, my next question is, you found Hope, and of course we are US based and have a particular kind of approach. We try to leave it as something that can be adapted to the community and to the individuals that people are working with, or even within a family. But how did you do that? How did you transition from hearing about Hope, liking the concept, understanding that it had value, to actually adapting it to fit the community that you're in? Or did you feel like you had to do a lot of adaptation? So I guess I'll start calling on people. Tiniola?
So for me, a lot of my work involves capacity building, because I don't work directly with families or caregivers. I just work with community organizations or the municipal government, and just kind of talk about, like I said, provide that awareness about ACEs, but also talking about PCs. So I adapted from the Hope framework by incorporating that into like workshops that I'm facilitating or community-based presentation, because the Hope framework speaks to the aspect of the upstream work that I'm doing of shifting that social norm that supports caregivers and children to provide that shared community responsibility from a strength-based approach. So through doing this in my facilitation or presentations, I've come to realize that my audience appreciate learning more about pieces, understanding the 4 building blocks of hope, and because it helps them to shift that narrative and provide that content from a strength-based approach. So they're able to see how hope it's like important in providing in helping to mitigate and buffer the effects of ACEs. Like of course when I'm doing the facilitation, I talk about ACEs, just give an overview of ACEs, but we just focus more on the pieces, and I find that they appreciate that more, and they always want to learn more about this and see how they can incorporate that in their programming when they're doing like SCL or supporting caregivers and parents. So that's how I incorporate the Hope framework.
Great. I think that's so important. I do often hear from organizations that say, you know, I don't provide direct service, but I'd really like to figure out how we can utilize hope, as you said, in the upstream approach. And so it's really helpful to hear how you've been able to incorporate that and in that way be able to affect a lot of children and families, that maybe even more than if you were doing that direct service work. I'm just choosing people. Rebecca?
We haven't found that there has needed to be huge amounts of adaptation, although there's certainly some adaptations that we have made. So, for example, we've embedded Australian research as we deliver these presentations and talk about the Hope approach. We try to contextualize it as much as we can in Australian research, also in the Australian service context, and so those kinds of changes needed to be made. Also, we have changed the images so that the images are much more Australian looking when we're doing a formal presentation, and so that's another important way that we've adapted it so that it looks Australian. I think we're going to talk about this later, but American materials have a very particular look, which are often very glossy and shiny, and people with perfect teeth and things like that. And Australia sort of has a different image that it relates to, which is a little bit earthier and a little bit sort of less glossy, I guess. And so we have adapted some of the materials so that they are images that Australians would probably more strongly relate to. Lynn might have some other thoughts as well, but those are the main things that have come to mind in terms of our adaptations.
Lynn, did you have anything to add?
No, actually, so that's been a process we've been going through in terms of delivery of the framework, but I was sort of thinking about how I was needing to adapt it or not in the context of to other sorts of communities that we engage with, which is the practitioner community who are actually going to be using the framework in their work, and the client community, the families themselves. And so the adaptations that were needed to be made in terms of the practitioner community, yes, we made those adaptations that Rebecca's talked about in terms of, how the materials presented, but we really didn't have to adapt the framework. I mean, like me, the practitioners sort of rejoiced in having a clear framework and language they could use to explain their approach. And building on what Taniola was saying and previously, this kind of giving an articulation to strengths-based approaches, what strengths, what to build, but in terms of the client community, we've had to do quite a lot of thinking about how we adapted the messages to that. Was the client communities we're working with, which have been subject to often multi-generational adversity, to be talking with them about positives when they've spent their whole life being judged by their risks and their adversities, is actually something that the families really struggle with. And so it really is quite a lot of work about how we frame the discussion, how we talk to them about, you know, where their strengths lie in these in the 4 building blocks, in terms of supporting them to focus themselves on positives instead of, you know, deficits, or the permanent message that they're getting about them being the source of community's deficits. I mean, once they get on board and they change their own approach to be hopeful, I mean, then it becomes really, really exciting. But because it's a framework and doesn't sort of come down to the specifics, which is, I think, one of the strengths of the framework, and why it doesn't, you know, need to be kind of, it's always being adapted in the individual cases when we're using it, thinking about families, because it's very easy for each family and community to bring their own understandings of ways to build positive experiences, and what does positive social connection look like, what does positive emotional growth look like. So I think the way that the framework is structured allows that flexibility to work with practitioners and families around their own unique understandings.
That's great. I'm really fascinated by the approach that you and Rebecca just talked about. And so kind of going back to first what Rebecca said about the images and about actually presenting the materials. That's one of the things that we really try to focus on, right? Showing diversity. Even I would say on your screen right now, I purposely looked for, you know, what might be grandparents, right? Other, you know, different family makeups. And so it's really interesting to hear and to contemplate that even the types of pictures and imagery that we're using may need to be more relatable in a particular, you know, community or cultural context, that people outside of the US aren't necessarily, you know, used to that glossy, glamorous kind of look. So that's really, really interesting, and putting it all into that Australian sort of, I think I took on my notes, you said Australian service context. So making it all look Australian, I think that's really important.
It's quite funny. If something's too glossy in Australia, it seems disingenuous.
Oh, you know,
yeah.
That's interesting. I think it does for us too, but for some reason we keep doing that to ourselves. But yeah, that's quite interesting. I think, you know, I think in my experience, it's like we end up aspiring to things that are not really realistic. But oh, I do see this. So I do have a comment here that Australians don't wear gumboots to the beach. That is fair. That's totally fair. So that's a really interesting comment, and just an interesting you know, concept when looking at adapting the framework and what diversity can really mean in that context. And then moving to what you were talking about, Lynn, with messaging with families, it's not so unfamiliar. Our director, Dr. Bob Segi, you know, often tells a story that I'm going to completely mess up, but talking about a parent, it was a mother who was told something positive in her appointment, and her response was that she'd never been told anything that she was doing right before. And so it's an interesting concept, because not only are professionals sort of trained that we're looking at the negatives or at adversity, and that's how we judge people, people are absorbing the idea that they are being judged, and sometimes are judging themselves. I know I've been in the situation where I'm taking my son to a doctor's appointment, and they start asking me all these questions about, you know, what's going on in our lives. And immediately my antennas go up, because it's just not that familiar. So hopefully with Hope, we'll be able to help people to make that transition, you know, within families and also among service providers. And I think we have one more person. Saya, would you like to jump in on this one?
Sure. I actually got goosebumps just listening to everybody just now, because isn't it amazing that we are literally at opposite ends of the world, and like this still works, and also that the families are so similar, because I recognize I also recognize the shiny American glossy pictures. But something really resonated about what Lynn was explaining, of how I've felt sometimes that the families in the sort of most vulnerable circumstances, probably due to, as you explained, they're so used to everybody else looking at what's wrong with them rather than what's sort of strong, that they almost can't see it themselves anymore, all the positive experiences that they are managing to provide for their children and the relationships that they are building. And that is something that we've thought about a lot as well here. And I think it can be very difficult in the beginning for the families to even see. And also, I think one of the most concrete ways of adapting, I actually, mostly due to the clientele, but also because of we're going to pilot these mapping ACEs and PACEs with young people. We've actually developed little symbols for each ACE, and also for the positive and protective experiences that young people have helped develop. So that's been quite exciting, because it's led to a lot of discussions on how they view their lives and the important people in them. The one last thing I wanted to add as well is in many ways I feel like this sort of approach gives meaning, or like a, how can I explain it? I think it often helps professionals feel that the work they're doing is meaningful, if you know what I mean, because they're also focusing and sort of helping build the good. I think it's been refreshing for many.
Yeah, I would agree with that. And there's so much to unpack in what you just said. The first part that I just wanted to touch on was, talking about young people creating those visual symbols. And I think it's so interesting to understand how people actually experience what's positive or what's adverse, as opposed to that being defined at some, higher level. So how does the individual or that family actually experience this event? Is it traumatic, or is it something that's positive that, has a positive impact? And then I really, really love that you brought up the idea that it gives meaning to the work that people are doing. I think there are so many people who work with children and families who just intuitively know that it makes sense. And we've talked about the prevalence of strengths-based approaches and how much we talk about it, but hope can kind of give it a little bit of shape. And oftentimes, from what I hear, kind of says, yeah, you're doing the right thing. And here's sort of the science that backs that up. And so I do think it can give meaning. But the one thing that I thought that I heard that came up was the humanity. And so when you first started and talking about how everybody so far has kind of talked about similar situations and the families that they work with, and thinking about us being across the globe, that aspect of just humanity is kind of the thread that weaves all this together, and that families, children and families, no matter where they are, kind of have some of these struggles, whatever they are specifically. They still share that and want to do what's right for their families and are trying to find ways, and all of them are doing something positive. We have a couple of comments / questions. So a couple comments. So one is that being heard is a positive experience, easily shared, even with the most traumatized. So that's a great point. Actually giving people the space to be heard is in and of itself a positive experience. And then we have that was from Michael, and we have something from Anne, who loves the conversation around images, creating a welcoming message. We started an open source photo bank in Washington State to overcome some of this. But can someone comment on fatherhood inclusion in this context? They often do not see themselves represented. Does anyone want to respond to that? It's an excellent question.
We have the same problem in us in imaging in Australia. We don't see there's a lack of representation of anything other than the nuclear cisgender heterosexual, family. So we don't see a lot of fathers. We don't see a lot of LGBTQI families represented. I love that you've got the grandparents. We don't see a lot of grandparents. We don't see a lot of, and particularly for our very adverse families, we don't see a lot of, foster and kinship families represented in our imaging. And I think that's a really interesting point, because it does actually, the imaging creates a narrative in our, a discourse and narrative in our society around, that the families that we work with don't see themselves fitting into, that actually creates incredible problems. We've tried to do a lot of work to kind of make our images in the work we do much more inclusive. But it is something we absolutely and have to be incredibly mindful of.
Would anyone else like to comment on that? Okay. And we certainly have seen that as well, and continue to try to, have that representation in imagery, but also, recruiting people to participate in activities related to hope. In particular, we have the Family and Community Experts Council, which is Faces of Hope, another acronym for you. And I think we have one father that we were able to recruit, but we are going to continue working on it. But I do think that is something that is universal for a lot of us as well, unless any of the other panelists have a different experience.
I can just speak briefly to this. I think it's also something that we're also looking at, like now programming and like connecting with organizations that work like with fathers to kind of talk about like hope and importance of relationship. And in one of the community here in BC, there's a community organization, a group called Dads. So it's a collection of dads, and they gain like tools and resources and capacity about how to be involved in supporting their kids, and they offer like relationship-based training programs such as anger awareness and men in relationship and attachment parenting. So one of my colleagues actually had the opportunity to kind of like speak to that community group, just talk about PCs and also use some of like the hope framework and some resources just to talk about the importance of the responsive relationship between fathers and children, and how that helps to promote healthy child development. But yeah, it's definitely something that we're also like seeing that it's kind of missing, and how can we continue to support this, because even in some like facilitation workshop that I do, or community presentation, it's mostly, we don't really see, there's not that big representation of like men or fathers involved, but yeah, it's something we hope to see more. But yeah.
Thank you. And Anne just commented, hope for dads, fantastic, and so important for early development. Okay, we'll go to the next one. I don't know if you all have encountered any of this, and we may have already touched on it, but were there any particular barriers to implementing hope or to using hope? Was there anybody who just wasn't buying it or was particularly resistant to this sort of shift in the mindset, as we've talked about, from focusing on deficits to having a more positive, strengths-based approach? And I'll leave that open.
I'm happy to start. The only barrier we've come across is at the policy level. And I think because at the policy level, I think in Australia, they're still buying into the discourse of deficit. I think, as Sawyer was saying, I think they still buy into, as I said, I'm a child and family health nurse, and we talk about the, you know, and there's a public perception that, oh, we just get to sit around and play with children. That's not work. Which is where this hope discourse is so, this hope framework is so lovely, because it gives evidence to the work, as Sawyer was saying. But, you know, so for example, we recently did a review of the perinatal mental health policy for a state health department, and the existing policy was totally framed around assessing and responding to risks and deficits. So in the recommendations, we included assessment of hope and, you know, positive experiences, but that recommendation was rejected. And so I'm sort of, you know, very puzzled, we were very frustrated by that. But I think, you know, our government, at least in Australia, I'm not sure what Rebecca's view is, and how this plays out in the rest of the world, but, you know, we're still dealing with very risk-averse government agencies whose, you know, primary focus is staying off the front page of the newspaper, and, you know, failing to prevent adversity gets them onto the front page of the news if a child gets hurt or killed, whereas failure to provide positive experiences isn't going to make the front page of the you know, the Washington Post. So I think that there's a lot of work to do around the pervading discourses of policy and their risk aversion.
Absolutely. Oh, sorry, Alison, is it okay if I follow on? Yeah. No. So yeah, yeah, couldn't agree more with Lynn's comments. I think absolutely spot on. I do think there was another. I'd be interested to know if this experience is something that we share with our international colleagues. But I mean, another sort of barrier that we faced, or potential barrier, was around others in our Australian context who are doing similar work and developing frameworks, you know, also looking to develop a framework that is strengths-based and gives focus to pieces and opportunities for positive experiences. And so there was initially, we got quite a strong response initially, and concerned that we were bringing in an international framework rather than adapting and promoting an Australian framework. And so there was that it was really important for us to make sure that we built those partnerships and those relationships, and that there was understanding that we're all actually on the same page here, that we're all working towards the same thing, and that there's strength in alliance around, you know, promoting these issues. And the advantage of hope for us is that it is a global community, that it does mean that we can link in and be part of an international body of research and an international sort of brains trust, and that there's great strength in that, and the potential for impact and from learning from each other. And that's what we see as one of the most significant advantages of being part of this network. So I don't know if others have experienced that as well, but just, you know, making sure that we're not setting ourselves up in competition to other people who are also doing really good work in this space.
Does anyone else want to jump in? I heard kind of two things: that idea of competition within the space and connecting with the international community, and then also really having to interface with policymakers and changes to policy, and the focus being more on deficits than strengths. Does anyone else have that experience in your part of the world?
I certainly recognize it from Finland as well, and the systemic practice that I was talking about previously really came to Finland after a child basically got missed by all the authorities and sadly died. So, but I think it's such early days here, and I'm sort of very much in the beginning of the journey, that I wouldn't want to sit here and tell you about any barriers that I've overcome. I'm sure I've got plenty yet to overcome, but the one thing that I have sort of tried to get across, there's a really wonderful word in Finnish that doesn't really translate into English. I even just Googled, somebody else has looked it up as well, but it's like, it's a mixture of accountability and responsibility, but when you put it on somebody else, if you understand what I mean. So so what I'm trying to say is that unfortunately a lot of the ACEs, as we all know, happen inside the four walls of the home, and we can try, and we should try, of course, to identify any children and young people that are living in a home where they don't feel safe or where they're not safe. But we're never going to manage to identify every one of them. And if we look at the positive experiences, I mean, I'm not saying we should just shrug our shoulders. Of course, we should never give up. We should always try and identify all of them, because any one missed is one too many. But what I'm wanting to get across is that the ACEs happen inside the homes, and we know that there are many children who are living in unsafe environments, but the positive experiences happen outside of the home, and that's where I want the responsibility and the accountability to be with all of us who, oh wow, responsibilization, I love it. Is that a real word, or did you just make it up, Lynn? Can I have it?
No, it's a real word, and there's an emerging body of literature around it as a concept, which is
Fantastic.
The idea of you know, particularly critiques of it in the neoliberal context of pushing responsibility to, particularly to those who have the least capacity to be responsible, to take that responsibility, in i.e. individuals experiencing adversity. So yes.
That's new to me. Well, fantastic. Thank you. But basically, yeah, that pretty much wraps it up. That I wish that we could all see that protecting children and young people is something all of us can do in the community, because that's where a lot of the positive experiences and the protective experiences also happen, and they will mitigate the ACEs if we can't stop them accumulating at home, which we should never stop trying. But if you get what I'm trying to say.
Yeah, absolutely. You know, I would say that here we also kind of run into some of these constraints and barriers. I don't know if everyone has noticed, but lately we have been posting some blogs that are related to public policy and kind of how you know, hope can fit into that, and trying to make it relevant for people. And so you may have seen that we just did one about the, you know, pandemic era SNAP benefits being removed and how that can impact the access to positive childhood experiences. And it's for that reason, because everything for so long has been focused on the adverse, and policymakers also are unaware, and when people are advocating for policy, are not really connecting the dots and understanding how this all fits in and what we can do collectively to try to promote positive childhood experiences. So again, it sounds like even though we're all spread across the globe, we're having some of these similar experiences, but I love that we're able to connect, at least tonight. And I wrote it down. It is responsibilization, I think, responsibilization. So that's great. That should be our next blog, Laura. And so we have a comment from Michael, who says the community that is working to improve the quality of early education is focused on hope. And also noted, he says, I love the sentence from a recent Hope blog, quote, communities that value children cherish their parents. Great, thank you. And so our next question is, I think we might have already touched on this, but if anyone else wants to, you know, chime in on this, but from your perspective, what are the primary differences in supporting children and families in your setting versus the US? And so we talked a little bit about some of the adaptations and things that you've had to make, but are there some things that just really stand out that, you know, that it's just different, the systems are different, or, you know, you know, you're just facing something that's completely sort of unusual or atypical to a US setting or community?
I think there are many, Alison, it's Rebecca. I think there are many similar issues, but they manifest and look very different in different contexts. So, for example, we know that the US is a very multicultural society with, you know, lots of different migrant groups and such, and also an Indigenous population or First Nations population. Australia similarly is very multicultural country, but and we also have you know, very important First Nations Indigenous population, and so but they're different migrant groups and different First Nations people, and so while, you know, the issues are sort of similar at the highest level in terms of identifying those issues is important, they look really different because of the different cultures and communities that we're working with. There's another big issue in the Australian context is just distance. So Australia, I'm not sure if everybody is aware, is pretty much the same size in terms of land mass as the US. But I think you have about 12 times more people than we do. So I think, if I'm right, America has about 331 million people or something like that. Australia has about 26 million people. So while we do absolutely have concentrated populations within cities, we have a very sparse centre of Australia that very few people live in. And so, you know, there are really big issues around remoteness and distance that are huge issues in Australia that I don't believe that the US, I know you have it to some extent, but you just don't have it on the same sort of level that is a really prominent issue in Australia. And probably the other really big difference that comes to mind is just that Australia has more universal health and social welfare services. So a lot more, you know, access to support and to services that are universal. Sorry, I'm just repeating myself really, but, you know, there's more of that in Australia. There's more support in Australia than there is in the US. That doesn't mean that it's enough support. It doesn't mean that all families, that there aren't barriers for some families to accessing that support, that there aren't significant social inequalities within Australia, because there certainly are. But there is a stronger foundation in terms of universal services. And I think that's a very significant difference between the US and Australia as well.
Yeah, I think that's a really excellent point, and I'm glad you brought it up, because just having that sort of broad array of services and supports that exist, I think is really important. And in some ways, we just, you know, don't have that same social or community infrastructure here. And Saya, did you want to jump in on this?
Yeah, I was actually thinking previously that I'm sure you've heard Finland's been voted the happiest country in the world again, and there's many reasons for that, and I'm, you know, not dismissing it at all. It's all those reasons are also reasons why I chose to move back here after several years in England and the US. But it's not all rosy. I mean, we've got the universal healthcare system is fantastic, and so is the education and early childhood education as well, or play education, as I heard somebody call it recently in English. But society is becoming polarized, and especially young people, and definitely after COVID, if we can say that we're living after COVID yet, I don't know. We have a lot of young people with anxiety and mental health issues, and that's sort of you can tell that the effort in the preventative measures has been lacking, because now it's piling up in the sort of mental health care, which is not really coping, and then it means that the children eventually end up within child protection. So we have a lot of work to do, but luckily there is lots happening as well. But we're having an election on Sunday, so obviously children and young people's well-being has been a very hot potato. And one thing that I've been thinking about these past few days is there's been a lot of focus on hobbies here, and whether children have equal opportunities to have hobbies, or is it starting to be a thing that only sort of middle or higher middle class or income families can afford? And I don't know if I know enough, but it seems to me that that's one thing the American system does well. From my understanding, that there's lots of hobbies connected to school days or after school. And I don't know about the cost and how that's dealt with, or who pays for this, but I think that's one really, really important experience for children and young people to have, and I think we're sort of sliding away from that a little bit over here.
Great, that's interesting. Rarely do I hear about the things that we do well here in the United States. But you're right, there are with public education, there are activities and athletics and other kinds of hobbies that are connected to that school system. Did anyone else want to comment on this? I know we have a comment from Michael who says that was a great point about polarization. It's a challenge for us all. I think we can all say that that's been an issue globally for the past few years. Did anyone else want to comment on this? Okay, we'll just go to our last question because we're winding down on time. Are there any global challenges for children and families that you would like to see HOPE address? So is there anything that's going on that we've kind of missed in the National Resource Center that HOPE has not created is not aware of because we're US based? Is there anything that you can think of that you would love to see HOPE address that is in your community or your global setting? And Michael, really quickly, I'm just going to bring you here. We're going to take you off mute because I'm not quite here, like capturing what you're trying to say on this one. So can you talk to us, Michael?
Thanks a lot. Yeah, I think that I'm talking about children being in online chats, and I'm seeing a lot of very negative, distressed children being bullied online, for instance. And I guess for the modern generation, which is being brought up online, they're way ahead of the rest of us trying to understand the strengths and dangers of that environment.
Yeah, thank you.
And I think, Michael, also, the potential for positives or reframing what does social connection look like for this generation that's online. Yeah.
Yeah, I think that's interesting. And I think we all learned a number of lessons during the height of the pandemic on how things can look different and the different ways that children, youth, but also I think people in general are able to connect using technology. And then kind of going back to that discussion of who has access, that became a significant issue here. I don't know if that was an issue, globally, but certainly here, who had access to certain technology, who had access to internet, all of those things, people, in certain demographics being able to get out, having transportation. So some of those things really rose up, but it was a good lesson, I think, a learning experience for us to understand, how connectedness really works in a modern society.
I think I want to pick up actually in terms of the global challenges, the where this kind of discussion's got to about the polarization, who has access to online and what that looks like. So I think the key challenge and someone sort of Sawyer talking about the access to hobbies and those sorts of things. So I think the key challenge is going forward is the challenge of equity. Who has access to these positive experiences and who doesn't, and why? So whether that be racial, financial, ability, disability, family structure, or any of those structural and social determinants of health, and I think both within countries, but also between countries. And I think the opportunity to explore and document what hope looks like in non first world environments, non high income country environments, and indeed even and I think all of the countries represented on this this chat today have remote First Nations communities even within their countries that actually, in terms of to our shame in Australia, our remote First Nations communities have poorer outcomes in terms of health and education than communities in sub-Saharan Africa. So, so I think there's a whole lot of thinking to be done around what this looks like in non-wealthy nation environments.
Great. Thank you. I'm so glad you brought up that topic or made such a pointed statement about equity and how and putting that into the context of the global setting with wealthier nations. I think that was also something that we sort of learned over the past couple of years is that access, depending on the country that you were in. And so with that, we are winding down. So I just want to give everyone an opportunity to have a final word. So I guess we'll go to Taniola. Did you want to say anything to close us out?
Thank you for this opportunity. It's been really interesting learning from everyone on this panel and just kind of seeing even though we're from different countries, just seeing how similar the conversations we're having in terms of what's happening in our countries. And I look forward to getting more resources from Hope and seeing what Hope has to offer and how we can use that to continue to support our organizations that support children and families. Thank you.
Great. Thank you so much. Rebecca, would you like to go next?
Thank you. Yeah, also thank you for the opportunity. I really felt that Lynn's final comments were such a great note to end on. Those were my thoughts coming into this session as well, that it's so important to do a piece of work around what positive experiences look like in different contexts and how we support as many children as possible to have those. So I loved Lynn's comments. So I guess to sort of reiterate and support that as a really important way forward, and really excited to see the growth of the global community around the Hope work. It's fantastic.
Thank you. And Lynn, did you want to add anything?
No, just to say thank you and appreciate the Hope Network and its and Tufts and their global reach. And it's incredibly wonderful to feel supported in this work.
Thank you. And finally, Saya, would you like to?
Sure. I agree with everyone. I'm really happy to have been here. I've got so much to unpack. Definitely worth being up at 2 a.m. But I also wanted to say, Alison, you said a couple of times, you touched on it, that I want to add to the access that Lynn brought up, because you also said something that's really important in my mind, is that we need to be careful that we're not from the outside, or certainly not from above, determining what is an adverse experience or what's a positive experience, but really listening to the person actually going through it or having gone through it, because they don't always match. Sometimes from the outside it looks as an adversity, but it's actually been a positive or a protective factor, and the other way around. So I think that's also something that I want to make sure I remember. Thank you.
Thank you. Thank you so much. That was excellent. And I appreciate all of you. Like I said, there's a lot of different time zones. And yes, 2 a.m. is really, really special for you to be joining us. And so we appreciate it. And so one final note, this is kind of our pre-event to the 3rd annual Hope Summit that will start tomorrow. And this year it's all about practicing hope. And so if you've been with us that first year, it was about, expanding awareness and just all about hope in general. Then we moved into growing hope last year, and now we're practicing hope. And so that's why this was such a wonderful opportunity to hear about how people are practicing hope all around the world and how it can impact children and families everywhere. And as you heard, we still have work to do. And so you'll be able to hear and gain some insight and tools and tips and hear more experiences of others. And that is on March 29th, March 30th. Registration, I think, is still open. You can go on there. We have the link. And there's one more thing. Yes, this is the week of hope, by the way. So we are going to continue to be releasing information, new resources to help you to be able to practice hope. So we are doing lots of announcements and lots of new resources throughout the whole week to support you in your efforts of applying and practicing hope wherever you are. So thank you so much for joining us, everyone who attended this evening. And of course, thank you so much to our panelists and to Laura Gallant for helping to facilitate this from a technical perspective. And I hope everyone has a wonderful evening, morning, afternoon, wherever you are.